So, yeah, I would say, obviously, like any other physician would say, that medicine is a rewarding career, especially pediatrics, because I am a pediatrician, and especially community pediatrics. And there will be an opportunity in future where you might find an area of interest and a niche that you want to develop, and community pediatrics will allow that. You learn something new every day, surprising, be curious, and be humbled, because you might have said, no, it can't be that, but yes, it can be. So you always learn something new. Find a way to advocate for the children and for the patients that you see. And there's so much work to be done, lots of things to do. So I would say take on community pediatrics, find a niche. It's a rewarding career.
Community pediatrics is the best thing that you can do in pediatrics. There's lots of variety, and if you work in hospital and office, you have some opportunity for teamwork and acute care, as well as for chronic care and following patients and their families along for years.
I think it's a very exciting time to be involved as a pediatrician, to work with kids and families. Very important. I also think that we need to work with systems, and so you need to be open to working with school boards, with mental health facilities, with public health departments, to make interventions and systems of support that will really make a difference to the health and well-being long-term of kids. What an opportunity to be part of changing that for kids.
I would tell the students to come into a rotation in community pediatrics and try it out. I did that when I was in residency. I worked with Dr. Teresa Bruni up in Thunder Bay, and I thought, that's exactly the medicine I want to do. That's exactly the person I want to be. And so doing a rotation with somebody who is doing it and doing it really well was really inspiring. And so I would say if people are thinking about community pediatrics, to come out and try it and see what it's like, because I think they'd be really pleasantly surprised by what we do and how we do it.
What I would say is, take your time, check out different practices, look at different geographic locations, look at the individuals you work with or do locums with, before you engage. And there will be an opportunity to develop a niche. Yeah, take that opportunity to examine the landscape and look at different aspects of practice. There's lots to choose from.
You got to make sure that you balance your life and just don't go out looking after money. You know what I'm saying? You'll be always going after that. So I want you to balance your life, enjoy your life, do things that you want to do, and also spend some time with your family. That is very important, because you won't get that time back again.
I guess I would tell myself, grab the moments in front of you, try everything, do a bit of everything, try and keep some balance in your life, but in general, be guided by your passion.
When I look back, I think my career evolved a lot. So I think that I would suggest to younger pediatricians to keep their minds open to having their career evolve. I never imagined, for example, that I would become active in the BC Pediatric Society. I ended up being president, and I never imagined that I would be on Canadian Pediatric Society committees and section executives. Be open to new opportunities is a really good way of putting it.
I've been really blessed with many smart folks around me that I continue to reach out to. And so I, again, would urge community pediatricians, build those networks and keep them active and alive, because it's amazing how people toss up over time and, can really be simpatico with something that you're trying to work on or do. So
I listen to my colleagues speak sometimes and I think, wow, you keep me on my toes. And it inspires you to keep learning. The way that my community, and I mean not just the Orillia community, but the community pediatricians at large, how they care for the kids, how compassionate they are. You know, I really enjoy working with my colleagues, the other community pediatricians. It's a pretty tight-knit group, even right across the country.
What's amazed me is how first of all, obviously their dedication to supporting the children and families, and that was clearly seen through the pandemic. So both in terms of being there when it was needed, but also expanding their knowledge and advocating for better services and care when needed. And CPS has been a phenomenal organization to bring us together.
One thing that I found is that you learn a lot from your colleagues. So we get different knowledge as to how things have been done differently. So that's what I find with the pediatrician. We are able to put my brains together, and it helps. Of course, then there are lots of differences, but it's good to have differences as well.
One of the first things that inspires me is the amount of support and the camaraderie between pediatricians. The second thing that inspires me is the degree to which pediatricians care about and care for their patients and want the best for their patients and their families, and will spend a lot of time trying to do their best for them and make things better for the kids and their families. You know, we get up in the middle of the night when we're on call and go into the hospital and look after babies when they're being born and children who seem to get sickest in the middle of the night. And that's just what pediatricians do.